कहते कि बल फाउल दा तकला लका उदा डी दे opposite डी दे opponent kana तो डी के से वर्धन ना होते हां बंदे जी बंदे होते that's डी के दन ना हो बल जी बस kana अगर चिंता कम याद है इंडिविजुअल सदा नहीं स्टॉप और दिस टोटल नहीं हुआ ولا انا غير كده 60 كده شكل 60 ده يجي فاول بقى هو اول كده انا كده سكور بقى بورد पर टच और सीधे कमा बोर्ड टच को 60 सेकंड की ودومنا فوتبالي سارين ماشي وبلغ يبقى فاول هذا لارشي لانه بهرو دي مغابه
Assalamu alaikum. Naid Alam, please mute yourself.
غير بعد ذلك بس بال جا سره دي ना دي دي نمبر 1
Mr. Junaid Alam, I'm repeating. Please mute yourself.
बल شاته دی غیر مخ کې لاړو صحیح ده فوتبال کې
Can you please mute him? I guess host is having option to.
होस्ट के पास ऑप्शन होगा होस्ट सबको म्यूट कर दे।
Am I audible? So, Assalamualaikum. I am Fatma Riaz, the Vice President of Capacity Building from RMULC. As well as I am the Capacity Building Development Assistant to the National Vice President of Capacity Building in the National Team. And today we are having Scorpy 101 session. And what is basically Scorpy? So Scorpy is the standing committee on the professional exchange, and it is basically providing a platform that facilitate the clinicships for the medical students, and it provides opportunities for the student to gain practical experience abroad, and foster their global health awareness and intercultural understandings. So basically, before the introduction of the speaker, we will be going for the icebreaker, and then we'll be with the introduction. Okay. So, guys, I'll pick any one of you to introduce yourself, and then you have to tell your hobby. Okay. So, Ati, are you there? Okay. Manu Rafi, are you there?
Hello, Assalamualaikum.
Oh, okay. Ati, kindly introduce yourself and tell your hobby.
Okay, so my name is Atiq Rafiq, and I am from third year MBBS Meridian Islamic Medical College, and my hobby is to play basketball.
Okay, great, great, great. So now, Saad Rehan, are you there? Saad Rehan? No. Okay. Manu Rafi, are you there?
Yes, I am there. Can you please repeat your question?
Yeah. So can you introduce yourself and tell your hobby?
Okay, I am Mahnur Khan, National Officer for Scorp, MSA-Pakistan, and my hobby is to listen music, to read novels, fantasy novels, and to travel around the world. So yes.
Oh, okay, great, great, great. So okay, now Fatma Asghar, are you there? Okay, yes. Saban, are you there? Saban, you have just joined. If you are able to, you can. Okay. Are we having any volunteer who can introduce themselves? Okay, yeah, sure, 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 sure. Fatma Asghar, okay.
Assalamu alaikum.
Fatma. Well, sir.
I'm Fatma Asghar from Bolan Medical College, Quetta, and I'm the current local officer for Scorp in MSA-Pakistan.
Okay. Great. And Fatma, tell your hobby as well.
Painting, reading novels, and listening to the music is my hobby.
Oh, great,
Thank you.
Fatma. Okay. Okay, now I'll go for the introduction of the speaker. So today we are having Faris Al Jazeer, and he is the speaker for today, and he is the local exchange officer of the IFMSA Egypt, and he's a fifth year medical student from Cairo. And we're very happy to have him today for this session. And now I'm handing over to him. Faris, you can start.
Hello, everybody. Is everything clear? Can you
Yeah.
guys see me?
Yeah.
All right, let me just. Right. So, can you guys see the PowerPoint clearly?
I guess it's clear.
All right. So let me first introduce myself. I'm Faisal Jazar, as she said. Thank you, Fatma, for the warm welcomes. So I'm a fifth year medical student right now. I'm the local exchange officer in Cairo, and we do host a lot of exchange incomers. So I have a lot of experience with them. And hopefully I'll be telling you guys a thing or two about how the exchange will offer a new perspective to practicing medicine, and how your clinical assets is different to where you go on an exchange to. Of course, I'm passionate about global travels and the global healthcare and being part of the IFMSA exchange family. So yes, let's dive into it, and let's start first by why clinical skills differ across borders. Of course, medicine in itself is a universal science. However, healthcares are not to be the same across the entire planet. Every country has its own resources, has its own cultures, has its own. It had medicine developed in a different way. So I'll give you guys an example. So if you are to have a heart attack, God forbid, in Canada, your treatment would start with a fully equipped ambulance that would rush to your place, that has a mini ICU within it. On the contrast, if you were to fall sick in, let's say, Venezuela in South America, you wouldn't find the luxury of being escorted in such an ambulance, or given something like the PCI, the percutaneous stents. So it's just different how medicine differs really from a country to another. Let me give you another example. Here, of course, in Egypt, in Africa, we sort of have limited resources. So our interaction with patients is more on a clinical basis, because you just cannot afford to send your patients to have a full list of investigations, from the ultrasounds to the X-rays to the MRIs to CT scans. You just have to be very to have a high index of clinical vigilante, and just be a very suspicious doctor and clinically gifted to try and at least filter through your patients here in Egypt. I would presume the same in Pakistan. I would presume that due to you just do not have the availability to just have a CT scan for every case of head injury. You would just need to first of all have a full neurological exam, and hence why each country learns medicine in its own way, and according to the available resources. That's how it starts to filter through patients and starts to go and provide care. So if you are about to go on exchange, of course, somewhere like in Egypt here, you would find it familiar. You would find that our treatment starts with good clinical history. It starts with a very extensive clinical examination, because, as I said before, we just cannot have the leisure to send everyone to do a CT scan, or send everyone to do some laboratory markers or such. You just have to extensively filter through them. However, if you would go on an exchange abroad somewhere, let's say in Germany or so, you would find them not per se less on the clinical side, but they would definitely order more investigations and be and just because the whole insurance systems and such, it would just you would find it a clear, quite difference there. Right. Let me give you another like a more overview about other places on Earth and how their clinical skills differ from one place to another. So I don't know if you guys are aware, but the United States is heavily monetized and privatized, to a sense of the clinical care there is not very accessible. It's not there are healthcare insurances, but they're not the mainstay there. And that's why you find patients there paying extensive bills for basic medical necessities, something like a appendectomy that you would have routinely done here in Egypt or in I would presume as well in Pakistan. It wouldn't cost much. It's just a normal general surgery. However, the privatized sector of healthcare in America just pushes people to perhaps omit a lot of healthcare. People would go with dental problems and they would just not look to it because of fear for such a high medical bill. So the clinical practice there is you're just bound to find it very different. I myself, I went on an exchange in Ireland, and I was exposed to things close to the NHS, if you guys are aware. I went to Ireland and I went privately to somewhere in the UK as well. It wasn't an exchange, but I saw there medicine was very different, in which the doctors there were very keen on documenting everything. Everything was documented on their laptops all the time. You would find from the small doctors, the specialist, or even the general practitioners, and up till the consultants, they're all just glued on their laptops, documenting everything because of how ruthless their healthcare system is. It's just you would need to always cover your back because the healthcare there is completely public. It's completely to the government. So any problems that would arise because of a malpractice from your side as a doctor reflects on the government and reflects on just arising problems really for the healthcare providers. So I myself found it very different, and I'm sure if any of you guys are interested to ever go on a professional exchange, you guys would also find that. Which takes me to a very good question. Is any of you guys like have you guys ever been on an exchange before? Any one of the attendees here in the sessions, have you guys been on an exchange before? If not, you could also just nullify and tell me if you haven't been on an exchange.
I don't think so there is anyone.
Right. Yeah, I was just asking, like, are you guys, any of the attendees, are you guys interested in going on an exchange outside of Pakistan soon? Hmm. Well, I was going to tell you guys that exchanges, like it's the next slide really. I was going to like, let's have a small activity here. So a patient comes in with a chest pain. How do you think the medical approach would be in your home country in Pakistan if there is a chest pain, a patient coming in with a chest pain? How do you think the medical approach is in your country? Come on, guys, I need a response here. Tell me, how do you think would be the response here in Pakistan when a patient admits to a hospital with a chest pain? We're all medical students here. We're aware of this. So someone please unmute and have a conversation. Anyways, I was going to tell you, like, here in Egypt, for example, if there is a chest pain patient, we take him first to a standard ECG and then a standard chest X-ray, which are the basic investigations. And we wouldn't go to the extra mile and start the cardiac enzymes and such until we are sure that there is an ischemic insult or that there is a gain per se from doing such an investigation. So we do rely heavily on the clinical manifestations and the clinical findings that we have after hearing his pericardium and such. So for example, that's how we take it. But an approach, let's say in Italy, there would have to be multiple consent forms signed to do something as trivial as a EKG. And there would be multiple specialists also attending the case here to provide care from different sectors. However, in Egypt, it could be led by just one physician per se. So these are some of the differences that we have. Right. So I think it's time now for a quick energizer because we're approaching half of the session here. I really want to know you guys more, actually. I'm interested in the individuals here in Pakistan. I used to live in Saudi Arabia back before medicine, and I had a lot of friends from Pakistan, and I know a thing or two in Urdu. So who's here that I can ask something in Urdu? Maybe that could energize the session a little bit. Anyone interested to come up for the mic? I'll ask them a question in Urdu because I know how to ask a question in Urdu. Come on, guys. Do not fear. I do not bite.
Yeah, you can ask one from me.
All right, sure.
Hello.
So yeah, hello.
Hello.
First ask Fatma, then.
Sure. I used to, my friend used to know, like my friend told me to, I learned from a friend how to say, how are you? I think it was Kya masla hai? I think.
No,
Because,
it's कैसे हो आप?
what?
कैसे हैं
Oh,
आप?
oh my God. No, I think I missed up. I think that's not Urdu, right? It is Urdu.
Yeah, it is.
Oh, perfect. All right.
Like it's Urdu, but yeah.
I think there's also chalo, something like
Yes.
yalla. Yeah, it's like let's go, right?
Yes.
Yeah, so so that was me trying to energize the session a little bit. I'll leave it here for Fatima, and I'll then continue on the session. I think we're like halfway through, so I'll continue, guys. I'll continue with you guys swiftly.
Okay. So now I'll like to call Atik for the energizer. Atik, go for it. Atik.
Okay, so I would like to pick one person and then ask that he would choose truth or dare, and then I'll ask questions. So are you guys ready? Mm, I would pick Syed Dawood Shah. Syed Dawood Shah, are you there?
I think kindly pick Manu Rapiway.
Okay, so Mahnur, are you there?
Yes, I'm here.
Okay, so pick a number from first. Tell me truth or dare.
Dear.
Dare. Okay, so pick a number from 1 to 10.
4.
4. Hmm. Pretend you are introducing yourself to a group of foreign exchange students in 15 seconds.
Okay. A group of foreign exchange students.
Yes, in
Any
15 seconds.
country specified? Any specific country or
What?
okay? I'm hello. I'm Mahnur Khan, National Officer for Scorp from Pakistan.
Just this. Okay. So next, I would pick Fatma Riaz. Fatma, are you there? Hello.
Yes.
Okay. What would
I
you
guess
pick? Truth or dare? Yes, yes.
I'll pick Dare.
There. Okay. Pick a number from 1 to 10.
5.
5. Teach us a greeting, hello, in a different language, other than Urdu, please.
Okay. Okay. So I guess it's in Spanish. We say hello as hola. Like okay, I have seen Dora, in which I have saw like they are saying either each other as hola amigos. So hi, hola amigos.
Okay, okay. That's something new I've learned. Okay, so I should pick someone else or Fatma, it's okay. Just
Uh, I guess so. Pick Aisha Arshad.
okay, Aisha, Arshad, are you with us?
Aisha Arshad, are you there?
Okay, Aisha, Arshad, would you take a truth or dare? Hello?
Aisha?
Aisha, would you take a truth or dare, please? If you can unmute yourself.
Okay, I think go for the speaker and then we can start the session again. Ask the speaker.
Okay, Faris, bro, are you there?
Yes, mate, go ahead.
Okay, would you take truth or dare?
Truth, mate.
Truth. Okay, pick a number from 1 to 10, please.
5.
5. What's one thing you would pack first for the exchange trip?
Ooh. I mean, depends on the destination, you know. But
If you are going to Turkey, then what would you take?
if you're going to where? Turkey?
Turkey, yes.
Um, hmm. What would I pack for Turkey? Definitely my passport and charger.
That's you would take everywhere. Something new, please.
Something especially for Turkey.
Yes.
I think an umbrella because I think it rains there a lot. So
Okay.
I would take care for that.
Okay. Okay. Thanks. Now you can continue with the session, please.
All right, thank you, Atik.
Thank you.
Right. So now we discussed a lot about what are the clinical skill changes that you require in different countries. But now let me tell you more about what you can actually do to acquire these skills and to perhaps have a better exchange if you are to go outside one day. So I like my first tip here would be, first of all, to observe. Observation is what makes a special doctor, really. You should observe really how they talk to their patients, their posture. Of course, you could be in a country where you do not speak the language, but the posture speaks a lot. Like I know that in Singapore, our outgoings when they go to Singapore, you cannot have flip-flops or Crocs, the traditional Crocs that we wear at uni or at the hospital. You cannot wear these in Singapore. You have to just wear your normal shoe with a like a over plastic wrapper over it. Um, so you just have to observe. The first few days you have to be stick to the contact person that you're with abroad and observe how they talk, how strict they are with timings, how respectful they are to each other. You will just find a lot of different changes between you and your home country. So first of all, I think would be observation, and another tip would be just flexibility, really, and adaptability. Your just willingness to be different. You should be like water. If you're put in any container, you should take the shape of that container and be okay with just being adaptable and easygoing. I think you should touch up on your English skills because that's mostly the language you're going to use to talk to the doctors there, the medical staff there, and if you need any questions or just the communication channels, I think it's always going to be in English. So another tip is just touching up on your English, perhaps um, having sessions where you talk to your friends in English just to sharpen up your speech a little bit, so that it's clear and fluent, you know. Um, of course, you should have cultural respect. If you are to go to a conservative country, I think Pakistan is a conservative country. The Middle East is a conservative region. So people who come here in Egypt, let's say we just had incomers come from Brazil. From one of the first things that I tell them is how they must uh, wear modest. We do not really have tolerance for clothings that are revealing and are not modest inside of our campus. And they take it with an open heart, and that's what you should do as well as a member of IFMSA in Pakistan. You should just have cultural acceptability, and you should respect wherever you are. If someone demands of you to perhaps um, arrive at a certain hour, talk to a doctor in a certain way, you should always just follow their lead because they're the locals here, and you should have a degree of respect to that. And some of the problems that we face at times is some of the let's say some of the European incomers, sometimes they have a little bit of an ego, and they start um, let's say sometimes it's just it gets a little bit that they think that they know more than the doctor that's attending at the hospital here in Cairo. So it comes within, you just have to show them that you yourself respect your tutor and you respect your medical staff, and they will follow along. And if they do not follow, you should always give them a warning or such, because respect here is very important, because you don't want to lose your academic contact. The doctor that's helping you conduct the exchange should be respected at all times, and no student from anywhere in the world really should be able to um, say that that a doctor is wrong per se. So you should always be respectable, be humble, and if you perhaps see a doctor say something that's not completely correct according to your curriculums, you should erase such an issue in a small group on the side, and never just cross the lines really with any of the doctors. And I already talked about the soft skills, the communication and the humility, just being a very adaptable person in general. I think that's just common decency, and I think we do not really find a problem. We're all medical students. We're all coming from decent, good backgrounds. We're aware. We have a level of standard of education and such that you really shouldn't find this a problem. And these all will allow you during your exchange to have a more scope in which you see things. And you see, for example, I personally, I have been on an exchange in Brazil last September. And during my time there, I learned that some of the drugs that they use as painkillers are not used here in Egypt. We do not use something called metamizole. This metamizole is just not FDA approved, and FDA is the governing body of the United States. And for example, here in Egypt, we follow the FDA approvals. In Brazil, they do not follow it per se because they thought that this has like a political background to it. It's not really just because of it being medically inferior. They think there is some sort of politics involved in it by the FDA and such. So during my time there, I found that they have clinically different modalities to pain. They have a completely new drug that they use, and it's very effective there. So during your times outside of your country, you really should take the opportunity to catch all that you can from that country. Um, yeah, that's my advice for you. To always have keen eyes and to listen more than you speak, and just absorb the backgrounds around you. Right. So we're in the penultimate slide, which is going to be the roles of Scopy Exchange. So I asked you guys prior, do you guys plan on going on an exchange out? And none of the participants did participate in that. But I'm genuinely curious, do you guys host incomers? If any of the attendees would have the courtesy to reply. Do you guys have incomers? I'm just interested in knowing the approach here. What do you guys what do these incomers find different about Pakistan during their exchange?
Kindly see the chat box. Some people are writing over there.
Oh, perfect. Yes. How can I open the chat box? Yeah. Yeah. Oh, Sharjeel, you are planning to. Right. Could you please tell me where do you want to go, or like if you have already an outgoing contract or such? Oh, someone typed. Yeah. How about Cairo? In what sense? Like, do you want me to tell you what clinical differences that you might find? I already touched upon that, how we are very clinically invested. For example, we had a Norwegian incomer 2-3 years ago, um, and we had them go to a pediatric clinic, right? And during that pediatric clinic, she saw how extensive they palpate the liver, and in her country they skip that. If the abdomen is quite distended, they already just have the ultrasound and they start seeing for the liver. For us, there was, I think, 1 or 2 ultrasounds. Yeah, in 15 minutes, right? Yeah, and for us, there was a couple of ultrasounds probes. So it's just we do palpate more than we use the ultrasound probes. So yeah. And Sharjeel, you are more than welcome to be in Cairo. I think you'll have fun. It's a very vibrant city. The people are very lively, very welcoming. I would think so, at least. And yeah, you guys really should embark on the exchange journey. Thank you, Sharjeel. Thank you. Oh, Masr, you know the actual name, Masr. Yes, Egypt is Masr indeed. Right. So just again, because time is running out here, the role of the Scopy exchange for me, exchange has a very big personal side. It allows you to grow personally. Uh, also the clinical side, but the personal wise is just knowing how medicine is practiced, as we said before. It tells you how um, you're just not seeing medicine within your local scope. You're seeing it outside elsewhere, and just the diversity really creates a very unique doctor per se. And of course the connections, not connections, it's just the friendships you make, the connections you make, the acquaintances you have. These people you wouldn't have you wouldn't have met before. For example, this session, you wouldn't have seen this Egyptian guy tell you about FMC exchanges, and I'm really glad I'm having this time with you guys here, and I really like Pakistan as well. Really nice country. So we're approaching the end now. This is going to be the last slide. Yeah. So as I said, the adaptability here. Adaptability is very important. It makes for an overall better human. If you can be put easily, uh, just like a chess piece with like a whole team, I think that will make you grow. That will make you prosper in any position. And the professional exchange makes you go out of your comfort zone. It makes you go out of the box, and it just exposes you to different cultures, different medical modalities, different diseases. Like the people who came to Egypt here, they've never seen bilharziasis per se. They haven't seen much hepatitis C. A lot of the other rare diseases, because in Cairo, it's a metropolitan city. It sees like we get to see patients from all types. In Egypt, is Cairo the perfect city for exchange? What do you suggest? Well, I'm representing all of IFMSA Egypt. I'm not just representing my city in Cairo, but yeah, you could say that. And all of the other cities are really nice too. Sharm el Sheikh are more of like the resort areas. I don't think we have a local committee there. We have in Alexandria, though. We have in Alexandria, we have in Port Said, we have in a lot of other cities. But whichever city you may go to, um, you will find medical points that you don't really see back in your country. If you go to some of the cities that are away from the sea and away from the Nile, you will find to see thyroids that are enlarged, and you may have not seen that per se in Pakistan. So yeah, just at the end of the session here, I'm telling you guys that um, adaptability is very important. I'm encouraging every one of you guys to go on in the professional exchange, and I hope to see you again soon. I was really happy to be here with you guys today. Can we go to any country through this exchange program? Well, I'll leave that for the personnel in Pakistan to take care of that. Yeah, thank you guys. Thank you.
Guys, before ending the session, we'll be having a group photo. So everyone, please open up your cameras. Okay. I think you have to take the screenshot. Okay. Atik, are you there? Okay, great. Okay, great. Okay, so the picture is done. Thank you so much. This session was so great and I really enjoyed it. Hope so everyone have enjoyed the session as well. And hope so we'll have you in the future session as well. Thank you so much for your time.
Guys, the link to the link to post evaluation form was shared. You guys can fill it.